Thanks, Amy. Yeah, and good morning, everyone. I'm Alex, one of the flexible leads at NHS England, and I'm joined by my colleague Jess. Jess, do you want to say hello quickly?
Yeah, hi, I'm Jess, and I am the other flexible lead at NHS England.
Thanks, Jess. Yeah, and thanks for inviting us, Amy, and it's great to be on the call today. Um, we're going to try and give you a sense of where we think the NHS is at in trying to get to more flexible working cultures, but also talk about the challenges that are still within the system, but also the progress we're making and the good practice that we're seeing. Um, I suppose one of the key things for us, though, is that we want/need your input into developing solutions and sharing those solutions. So we want to know what the barriers and challenges are that you're facing and how you might be overcoming these as well. But if we go on to the next slide, Amy, and we'll get into some of it. So as Amy's alluded to, things have changed over the course of the last three years or so, and terms and conditions for Agenda for Change staff were updated in September 2021 to reflect the ambitions of the NHS People Plan, and the changes included enabling those on these terms to request flexible working from day one of employment. So if we go on to the next slide, we use those changes to terms and conditions as a jumping off point. So our vision across the NHS is that the NHS becomes an exemplary employer with flexible working embedded into the culture and values of the NHS. So that means saying yes is our default position from day one of employment, and flexible working is simply how we work. So that's where we want to get to. And that's now supported by key drivers, including things like the long-term workforce plan. Actually, I mean, if you go back one minute. Thank you. And within the long-term workforce plan, for those that you've been through it line by line, flexible working is identified as a key enabler for retention. So it's not just a nice to have; it's absolutely fundamental to us retaining our staff. We've summarised the key points from long-term workforce plan in the pack that we'll share afterwards, but some of the headlines include the fact that every staff member should be given the opportunity for regular conversations to discuss their well-being and what will keep them in work. There's also a desire/need for to extend that flexibility for learners as well as our staff in post, and we need different employment models and shift patterns to fully embed that and get to that culture around flexible working. And our ambition is to continue going beyond the statutory requirements in terms of flexible working. So always being in that modern position around flexible working to attract staff. And we need to consider flexible working options for every job and clearly communicate those for staff. So very ambitious, but that's where we're trying to get to and where we need to get to if we want to retain the best workforce we can. So if we go on to the next slide. We wanted to give a bit of a flavour of where we are now, really, and the reality of where we're working. And we know in last year's staff survey that told us that whilst we're moving in the right direction, it is gradual, and there are variations in different staff groups. There's perceptions on the opportunities for flexible working patterns. They have improved, and there's more of a feeling of support around balancing work and family life. And there is an increase in staff feeling they can talk openly with their managers, which is great. But we know that for medical and dental staff, we saw a decrease in the percentage of those saying that they can approach their immediate line manager to talk openly about flexible working. And across overall across patient-facing roles, they're telling us that they're less satisfied with work-life balance, less satisfied with opportunities to work flexibly, and less satisfied with conversations with their managers than those in non-patient-facing roles. Similarly, the People Pulse survey, the most recent results from that showed us that nearly 60% of staff were unaware of any of the NHS resources around flexible working, with 73% saying that none were actually used in practice. And whilst that's a smaller snapshot of our staff group, it's still it's worrying, really, in terms of the kind of impact that we may or may not be having, and the fact that we need to permeate through deeper into the system. We also know that the pay review body has said that despite the introduction of various of changes to policy and the Agenda for Change, they are commenting that there's little change in the percentage of staff that are satisfied with those flexible working opportunities going back to 2018. and they recommend that there's so much more work to do across the service to make sure that people have the support education systems to support staff to work flexibly. So more we can do. However, on a more positive note, the Exemplar programme that's currently running, which is testing the efficacy of bringing together all the people promise themes and focusing in on them, is showing that retention rates are improving across those exemplar sites. Leaver rates are showing they're decreasing faster than for non-exemplars. So we have the evidence that focusing in on the people promise, including flexible working, that combined effort is having a profound impact. And we need to harness that progress together with some of the anecdotal messaging we get from our networks. We've got over 1,000 people in our NHS England network now, and they're telling us about the specific challenges that they're facing, and that then we need to support so that we can build on some of the learning we're getting for the Exemplar programme. Okay, so if we go on to the next slide, Amy, and I'm going to hand over to Jess.
Thanks, Alex. So it really sets the scene in terms of some of what we're facing, and the breadth of the work that needs to happen moving forwards. And what I wanted to talk about was just some of the challenges, some of the themes around this that are coming through to us at a national level. And we've split these into sort of focusing on that organisation. So this is reflective of organisation, systems, regions, and what we're really seeing that people are struggling with to get flexible working right. And that is around the culture and leadership. So having that, changing those mindsets of the leaders within those organizations. The basics, we're still hearing from staff members that they weren't aware, and I think Alex has talked about that as part of the People Pulse survey. They just weren't aware of their right to request. They weren't aware of the legislation and the rules and the law that sort of really underpins flexible working as part of the NHS. That flexible working is really just more than a policy. So we have examples of policies being updated. They're taking a real sort of proactive step towards making changes that align those policies with the new terms and conditions. And then that's where the work stops. And actually, in order to be able to really adjust people's sort of their hearts and minds to move towards a more flexible culture, it is more than just a policy. This is a longer term piece of work that needs to happen. And that practical implementation as well. So and I'm sure everyone has stories. How do you translate the law, the legislation into this setting that you are working within? So particularly thinking about clinical teams, 24/7 services, rigid shift patterns, social care, primary care, those really tricky sort of areas where actually implementing flexible working is really challenging people. And then just from a national perspective, I think just looking at it from, for Alex and myself, the scale that we are needing to work to, we have 1.3 million people that we need to influence to really support flexible working to happen. And there is only 2 of us, so our resources are quite limited, but we recognise that we really need to reach more people. So how do we do that? How do we make that happen? And really, keeping in mind as well the timeframes to make culture change happen. So we know that making a change around flexible working, we are not expecting to see improvements in staff survey responses and results within 3 months, 6 months, potentially even 12 months. This is a 3 to 5 year plan around culture change that we're expecting to see some of those differences. And that this is not a linear process. So this is not a linear process for us. We need to recognise that we need to reiterate those basics, but also it's not a linear process for staff on the ground. They need to be having those iterative conversations with their teams and with individuals around flexible working, about their integrating into the health and wellbeing conversation. So what is working for them at the moment? What do they need? And that, and some of that really needs to happen. If we go on to the next slide, please. And so thinking about where are we seeing some of the work that's already happening. So there's some really good news stories. I know we've just talked about the challenges, but sort of moving forwards, you know, and talking about those, highlighting those projects and the areas that we know that some of the organisations are taking action on. So we're seeing work being done around advertising with Flex. So this is really moving into that space of having flexible working options when jobs are designed, when jobs are advertised. So we're having Flex in mind at that point, instead of having to retrospectively sort of embed it. Team rostering, so many pockets of good practice happening around team and self-rostering. Behaviours, real innovative behaviour changes happening. So thinking about any hours, 4-day working weeks, being able to use your annual leave. I think Milton Keynes potentially have done using your annual leave more flexibly as well, flexible retirement, lots around training and development that's happening in this area as well. And then the settings. So we know that what might work in a secondary care organisation or sort of setting is not necessarily going to be exactly reflecting in a primary care setting, in a social care setting, at an ICS level. And actually we recognise that work is happening across all of those areas to really make flexible working happening, and just with tweaks and differences as part of them. And data, actually, I was on a call yesterday with the people promise managers, and data came up again. It's becoming more and more important. People want to understand what is their flexible working data. So what is it that they need to be collecting and looking at? And then what is that telling them? And that's becoming so much more important. So not just looking at flexible working requests and approval rates, but integrating things like retention rates, reasons for leaving, sickness, absence, friends and family reporting, patient satisfaction. All of that is the data that sort of really drives some of that flexible working to happen. And on to the next slide. So, and this is slightly this is where our ask for you comes in, and you can just go on to the next one actually. So we'll talk about that. So this is about looking forwards. So we recognise as a team of just Alex and I, we need to reach more people across lots of different settings and across different levels to be able to achieve our vision. But what else is it that we need to be doing? So what are some of the challenges that you are experiencing within your organisations that you think you might need support for? And I think we might have commandeered one of the mentee questions that might come at the end of this session to really sort of gather some of that data and information, because we are doing our business planning for next year. And some of the things that we are thinking about is that who do we need to be talking to? Who is it that we need to be sort of influencing? The what, so what needs to happen, and the where. So we recognise that leadership, and especially that senior leadership, is always going to be a really big driver for us. This is about that culture development and change. We are actually starting to work with TimeWise. We're really excited about it, on a senior leadership development programme that will start in Q4 of this year, but hopefully into next year we'll have some evaluation and results from that and be able to look at how do we expand that, how do we look at the depth and breadth of that programme. Managers really supporting their competency and their confidence through training and development to be able to deliver flexible working effectively. And then, thinking about it at a system level, how do we create those more effective connections with people like our ICS retention leads, health and wellbeing leads at that system level, to really understand what those challenges are in that space as well. And that is it, I think. Perfect. Yes.
Thank you, Jess. Thank you, Alex. Thank you for highlighting that range. You covered a lot there, and I think particularly talking about that change in behaviour and culture and the need to kind of shift hearts and minds, and recognising that this is a change programme. We have got one question in the chat, which is just asking about how you're tracking progress across the NHS and whether there's any core measures you're looking at specifically. I don't know if either of you is able to take that.
Yeah. I was planning on ignoring that question, to be honest. But so we are tracking progress, but it's really difficult So we're able to track it through through kind of proxy measures around around leaver rates, around absence, and those kind of things, as well as some specific measures that we're asking ICSs to report back on now as to whether or not an organisation or a system, a provider has got board level champion, whether or not they are capturing data around flexible working locally, whether there's clinical leadership involved, whether they're advertising their roles in flex, etc., etc. But in terms of explicit flexible working measures, it's really difficult, partly because our systems aren't set up ably to support the recording of it, but also because we will always have, and this is in a positive way, informal and formal flexible working arrangements. So it's really challenging for us to get a handle on the breadth and depth of those. We are undertaking a piece of work at the moment to better understand the data that's in our ESR system, to see, first of all, the degree to which organisations are using ESR to capture formal flexible working requests, and then also to see, you know, the numbers within that, and if we can draw any information from that. Are there any trends of things kind of noticeably improved as different things have been announced in terms of the changes to terms and conditions, etc., etc. So we are tracking progress, but it's very, very difficult, and I think we're at the very beginning of that journey. So measuring via the ICSs, for instance, I think we're just in the second quarter in terms of asking for some of that data back around, have you got a board level champion, etc. So I think over the next 12 months, so we'll get a little bit more sophisticated. That's probably making it sound as though we're going to be fantastic at it. We're not, but you know, we will be in a slightly better position. But it is difficult.
Yeah, thanks, Alex. Thanks, really honest answer. I think you know, it will be great to see some of those shifts over time, but as you say, you know, we find this with a lot of work that we do, you know, across sectors. You are often relying on some of those proxy measures. That said, I guess flexible working is not an end in itself, is it? Like, if we remember why we're doing this, and it is about, you know, retention and attraction, you know, that kind of can tell us whether you know, we're moving in the right direction in those areas. Thank you both.